Let's talk about Biden. Now, this is from March of this year, and this is the facts sheet about basically what this administration has done to better your access to healthcare and drugs. Now, I'm gonna have to read between the lines here a bit, but lower prescription drug costs for seniors and families. Now, this is true. Inflation Reduction Act will save millions of seniors money on some of the most costliest prescriptions. But this doesn't really affect those not on Medicare. Manufacturers of 10 drugs remain at the negotiating table. It's okay. I don't know why we're negotiating drug prices one on one with several companies for their specific drugs. We're the United fucking States. And we pay like double the rest of the planet does for their for our medication. We shouldn't be negotiating with these companies. It's either you provide them for a reasonable price or you don't do business in the United States. It's just that simple. We can produce these drugs for the most part in the United States with American companies. We have a lot of American drug companies. And they already are making an obscene amount of money every year, more than they should be making. It wouldn't be all that unrealistic for us to say, you're an American company. If you want to continue functioning in the United States, you have to not oversell, not overprice your drugs. It's really obscene that we have to negotiate for individual medication prices as if the pharmaceutical companies are like a country. They're not. They're a corporation that we have the legal right to regulate. It's just stupid. Let Medicare negotiate drug prices for at least 50 drugs every year. Again, been into that. Budget cuts federal spending by 200 billion, increasing the number of drugs Medicare can select for negotiation and bringing more drugs forward. Now, hold on for a moment. The budget cuts federal spending by 200 billion, increasing the number of drugs Medicare can select for negotiation and bringing more drugs into the negotiation process sooner. To me, this wording spells out that the federal government is no longer going to pay the amount that it's paying for these drugs, and Medicare now has to negotiate for them, and then also pay for them with 200 billion less in federal spending. This is not a good thing. It's just hidden in between the lines. Now, if I'm wrong, please correct me here. If any of you have an opinion, if any of you work in the healthcare sector, I don't know everything, but that's what that reads as to me. Expand cap on out-of-pocket prescription drug costs. When the 2000 out-of-pocket cap on prescription drugs applies in Medicare in 2025, nearly. So again, this is Medicare. And the president is calling on Congress to expand the $2,000 out-of-pocket cap to all private insurances so that all Americans have peace of mind with knowing they won't have to choose between filling their prescription or food on the table. Leaving this up to Congress is a weak move. It's never going to pass. A $2,000 out-of-pocket cap for medications specifically on private insurances would also not help all that much for most people. As we went over, it's already like $14,000 to be able to use your healthcare to the fullest extent on average. And sure, if you've hit your deductible and you haven't hit the full extent of your out-of-pocket costs, then a cap on how much of that out-of-pocket costs can be classified for prescription drugs is nice. That's a good thing. it's just a very weak proposal that's never going to pass through Congress. However, adding this to Medicare is very good, and will help a lot of seniors. Like I said, the older generations are going to put quite a high emphasis on healthcare in this election cycle. So pandering to the older population with things that will help them, but not really help much of anyone else, is a good tactic for the Democratic Party to use, especially as they alienate younger voters at a unprecedented scale. Now, capping Medicare cost sharing at $2 for common generic drugs. Again, Medicare specific. This is good. Common generic drugs like high cholesterol, beta blockers, blood pressure, all that. Great. Wonderful. Access to cell and gene therapies. In January, HHS announced that sickle cell disease will be the first focus of the cell and gene therapy access model. Under this model, CMS. What is HHS? Hold on. Human Health Services, I believe. United States Health and Human Services. I got it the other way around. And CMS is Center for Medicare and Medicaid Services. Will negotiate with manufacturers on behalf of state Medicaid programs to increase affordable access to potentially life-saving and life-changing treatments. Now, this is great. It applies to Medicaid as well. CMS will release the request for applications for drug manufacturers of cell and gene therapies to participate in the model. Again, I think that we should just make them do it. I don't think we need to go begging to the drug companies like, oh, please would you, work with us? Please would you give us your drugs for cheaper so that we can help the poor, essentially. And it frustrates me because, again, this is another one of those industries, just like food that we went over, where the privatization and deregulation of these industries is leading to massive profits for a small group of people and massive harm for the vast majority of people. Drug companies that are nationalized and no longer function for private profit would still be able to produce these medications and would benefit the average American significantly more. We already spend tax money in helping fund these drug companies to do research and development. We don't need to be doing that. They have massive assets, billions and billions in assets that they can use to produce these medications. And yes, some of those medications are incredibly expensive to produce, but people still need them. And it shouldn't require the company to profit for someone to be able to access the medication. If they need it, then it should be subsidized. And yes, we live in a capitalist global framework, but under a economic socialist system, these drugs could still be sold for slight profit margins to other countries while also incentivizing them to move to a socialist system. But even without fully getting rid of privatized pharmaceutical companies, we don't need to rely on them to make decisions that are good for the average American. As the United States government, we should be able to tell a pharmaceutical company that they need to do a thing, and they need to do it now. And that's it. Done. No more. No argument, nothing. It shouldn't be that hard. Expanding the Inflation Reduction Act's requirements that drug companies pay rebates when they increase prices faster than inflation. Drug manufacturers must now pay rebates to Medicare if their price increases for certain drugs exceed inflation. The president is calling on Congress to require those rebates for commercial drug sales as well as sales to Medicare. This is good. Again, beyond that, I don't even, beyond paying rebates, they should just not be able to increase their prices faster than inflation. That it should just, they would need to, there would need to be special circumstances that they would need to ask regulators, like the FDA, whose job it is to regulate these drug companies, if they can increase their price faster than a certain amount because of a specific reason. This should already be in the law. And again, Congress is not likely to pass this. It would save the federal government billions of dollars. It would curb prescription drug price inflation and reduce health insurance premiums for people with private health insurance. But this isn't good for the lobbyists. Most of Congress is constantly lobbied by health insurance providers, by drug companies, by hospital chain CEOs. And they make decisions accordingly, especially in terms of healthcare, because of how explosive this topic is in our political conversation. And beyond that, how easy it is to manipulate Congress into doing what you want as a corporation. If companies not only have the ability, and lobbyists have the ability, to put money into PACs for election campaigns, which is legal bribery. We all know this. But beyond that, they have the ability to say, oh, well, I will move outside of your state. If a company is running several hospitals in an area and they're against the regulation that Congress wants to put forward, then they can threaten the congressman for their state and say, I will move my business out of your state if you don't vote no on this legislation. And that will result in the loss of thousands of jobs in that state. Now, the company can survive this. They can just open up in a new state. There's plenty of labor to go around. Plenty of people who need jobs. And honestly, plenty of people who would move state. If it was either move or lose your job, a lot of people would move if they had the ability to. But this would be very frightening to a congressperson who wants to win re-election, because losing a big donor, losing jobs in your state, is not really going to lead to a good voter turnout in your behalf. And this system that we've created here creates an incentive to bow to the companies. It's a race to the bottom. And this is what happens when we function with a system like this. We have healthcare providers who have such difficulty at work that they harm themselves, that they quit their jobs. We have 100 million people in debt, and most people can't afford their medications. We need more than calling on Congress to require things. We just need to do it. I'm not sure that the president has the power with executive order to do something like that, and it would be challenged in the courts as blah, 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 blah. Obviously, this is not an easy thing to push through Congress, but just like anything else, money is the main goal here. and curbing money's influence in our politics would open the door to making positive change in several fields. Putting high quality healthcare within reach. Today, more Americans have health insurance than under any other president, which is true. Although this doesn't account for the fact that even with health insurance, people still can't afford healthcare. Keeping health insurance premiums low. Thanks to President's American Rescue Plan and Inflation Reduction Act, millions of Americans are saving an average of $800 a year on premiums. That's about, what, like a fourth of what it actually costs per year? The Biden-Harris administration it's like 1 month free. Pay for 11 months of healthcare and get a month free. Just on your premium alone, not counting for your deductions or your out-of-pocket cost or your point insurance or your co-pays. And it's, yeah. Committed to keeping health insurance premiums low. President is calling on Congress to make the expanded premium tax credit and the Inflation Reduction Act extended permanent. This would be good. Without congressional action, millions of Americans will see their health insurance premiums spike by hundreds or thousands of dollars starting in the fall of 2025. That would be horrible, except it's probably what's going to happen because Congress doesn't really do much. They're constantly bickering with themselves and at a standstill. Closing the Medicaid coverage gap. The president continues to call on Congress to provide Medicaid-like coverage to people in 10 states that have not adopted the Medicaid expansion. First of all, why are they allowed to not adopt the Medicaid expansion? This is a federal program, and the federal government should have just the ability to say, no, every state now has Medicaid the way that it does. And beyond Medicaid expansion in the way that it is, it needs to be expanded even further, because right now you're only eligible to get on Medicaid if you're making under like $20,000 a year, which is just the absolute poverty rate. You should be able to get on Medicaid up to the average income. Really, healthcare should just be free and provided to everybody. It's obscene. Like, reading into this, it seems like the White House is saying, oh, look at what we're doing, but they're not really doing anything. It's calling on Congress to do something that they're not going to do. Keeping kids covered. Investing in our nation's children is a top priority for the president. Research shows that children are thrive and are healthier with health insurance. They do better in school. Keeping children covered is the right thing to do. I agree. President wants to make sure that children can never lose coverage due to red tape from birth until they are age 6, and that families only have to submit Medicaid paperwork once every 3 years. Kids should just be covered until they're adults. At the very least, like, you should have to fill out a form when you give birth to your child, and then your child now has health care until they're 18. At a very bare minimum. This is good, but it's not nearly enough. Closing research gaps in women's health research. First Lady launched the first ever White House initiative on women's health research to fundamentally change how the nation approaches and funds women's health research. Now, women's health is quite a contentious topic at the moment. Women make up half the population and have been understudied and underrepresented in health research for far too long. This is great. But again, the president is calling on Congress to make a bold, transformative investment of $12 billion to fund women's health research. Half of Congress wants to just outright ban abortion. Not half, maybe like a quarter. But like, this is not a thing that will pass Congress or even the Senate, for that matter. The gridlock in our system, the inability to agree with anything, the polarization of our politics, our government keeps nearly fucking shutting down because they can't agree to a budget half the time. The Republicans keep trying to oust the House Speaker over and over again. It's just like a bunch of monkeys sitting in a room yelling at each other, just ooh, 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 throwing shit at each other. That's what our Congress has become. Not that it ever really was much else than that, but money in politics has poisoned every bit of our system and continues to do so and prevents any real positive change. Like, some of these ideas are great. A $12 billion fund to research women's health is a great idea. I'm all for that. It will never pass. The initiative would also catalyze private and philanthropic commitments to increase funding for women's health research. Great. They should do that anyway. Make home care more affordable. Thanks to the American Rescue Plan, Biden delivered $37 billion to all states to expand access to home care and improve quality of caregiver jobs. That's great. Wonderful. 10 out of 10. Do that more. Increase that even more to everyone who needs it. Taking steps to improve the quality of Medicaid home care services and make sure that home care workers get a bigger share of Medicaid payments for these critical services. Calling on Congress to do their part to allow the hundreds of thousands of older adults and individuals with disabilities on Medicaid home care waiting lists to remain in their homes and stay active in their communities. This would be good. I'm not sure if this would pass Congress or not. This one might, as a lot of the Republican voter base is pretty against the idea of Medicaid and social services unless they need them. And this is one that many older Republicans would need. Ensuring access to mental health care. Ensuring robust access to mental health care has been a bipartisan priority for almost 15 years. That's bullshit. Including the enactment of mental health parity requirements, which require health care plans to cover mental health care benefits at the same level as physical health care benefits. Many of them are required, but still don't. Too many Americans struggle to fund and afford the care that they need. This has been an ongoing issue. Mental health care is a section in either the next section or part 3. We got a lot to cover with healthcare. But mental health care in the United States is so lacking that it might as well not be existent. For the most part. Like, speaking a bit broadly and hyperbolic there, but like, really you got nothing. Unless you have private health insurance and you can afford to pay for mental health care, which is expensive, very expensive, to be very, very clear. You're not accessing it. It's cracking down on junk insurance, surprise bills, confusing healthcare pricing. 1 million Americans from receiving surprise medical bills every month, taking steps to prevent Americans from being ripped off by junk insurers that prey on vulnerable citizens, and closing loopholes that to ensure consumers know what they're buying and can get their health coverage. That's great. Wonderful. That's something that they're implementing and don't need Congress to do. Great. Do it. Yeah, okay, sure. Proposed a monumental rule to help millions of Americans access high-quality, affordable health insurance and protect consumers from being discriminated against because of pre-existing conditions. Make sure Americans aren't scammed into low-quality coverage. Why we are working on finalized proposed rules that limit the availability. Great, they should do that. Discrimination based on pre-existing conditions is quite a big problem in acquiring health insurance anyway, which should be entirely illegal and just not part of the conversation.